So the topic is, from niche to necessity and redefining women's health innovation in India. I'd like to call upon our panelists here, Dr. Smita. Dr. Smita Karpate, please join us.
I'm Dr. Smita. I started one agency called In Science Healthcare Consulting Private Limited. We work for pharma, healthcare. I knocked the doors, got the purchase orders, delivered the projects, built the team, survived COVID. I started my own startup and investing in my own startup. I have a wonderful team. We thought, why not to do so? So it's called NXT Health. We have 3 different components of NXT Health. One where we talk to startups and doctors and experts, and it's an ecosystem that we are building.
So I am Jhilmil, founder and CEO of Cosmosis. So we are building the world's first breathalyzer for screening of breast cancer. So what we are doing is entirely new technology that we are working on, something called volatile organic compounds. So normally the markers that you find for any cancer or any diseases are present in your blood. And till now, the only way to detect such things or, any screening can be done by either blood or X-ray or MRI. So this is a new technology that we are building, and we just need around, few ml of exhale breath, and from that we detect something called volatile organic compounds, which are the last final byproducts of metabolism. So we have been working on this for almost a decade now. So currently we are in the regulatory phase.
So hello, I'm Dr. Manasi Naraka. I'm an obstetrician, gynecologist and an IVF specialist, and I'm working with Cloud9 Hospital, SB Road, for the almost 2 years now, but I've been in practice for more than 15 years now.
Interesting skew in the panel, and I think my first question will be to our sharpshooter here, Dr. Smita. You've been an operator, you've been collaborating with founders and a lot of them. What point in your journey over, say, the last decade or so, did you figure out that, this is underrepresented, underserved, or more rightly, let's say, ignored?
Yeah, luckily, being a woman and who survived on this planet for last 48 years, I have seen a lot, speaking specifically about women health. But before that, I've seen co-founders, quitting the job and quitting the, startup and going back to the job, prioritizing family, feeling guilty, and thinking whether not to go for entrepreneurship, not raising funds, not able to manage finances. But there is one recent example I would like to give you, which happened. So we do podcast, and we have this protocol that we'll do one pre-call before the podcast. And during that, this startup, which is a UK-based startup, and they are first in the world probably, they have a device which can identify pH and basal body temperature of vagina. And it's a device. So when she was telling me that this is what we are doing, and I was like, what's a big deal, right? Like, why vaginal pH? You should do something about the cancer, early stage detection, and this and that. And it took me like around a week. And yesterday we have done a recording of podcast. Now there I got to know that it's such an important parameter. For now, we have one from fertility, early identification of infections. What if they are able to seriously do early identification of cancer? Just a pH can speak so much about our health, and most importantly about yourself, right? So you can track ovulation cycle for your travel and your decision making, and you can track your hormonal cycle. But imagine if you are able to now get a parameter which is real time parameter in your device, and I can see, like, doctors may say that, okay, how's your pH? How's it changing? It's such a basic parameter, and they are funded. So they raised around 1.2 million before even going for clinical trials. So they're at animal studies level. So I feel that if I, who lived the life of a woman right from menarche to menopause, I've lived and have seen all the stages. I'm an entrepreneur. I have started the company. I worked with so many women. And if I was not able to understand that what problem they are solving, what to expect. So I feel it's grossly misunderstood.
Great. No, thank you so much for sharing that and putting that example. And that, I think, because of that example, I would like to ask Dr. Manasi, what is actually something that you are looking for in women's health as an innovation, or what is an actual problem that you're trying to solve, which maybe you have an example of an innovation that you've seen has helped, or which is probably on your wish list?
I really feel that menopause is an area in medicine, especially in India now, which is grossly under treated, under studied, because no matter, whether every woman goes through pregnancy or not, but every woman is going to go through menopause.
Right.
And unfortunately, there was this study that was conducted when I was a student, long ago. There was a women's health initiative study that was
Yes.
undertaken, which was about the risks and benefits of HRT, hormone replacement therapy. And they had to terminate the study midway because they found out that HRT was very dangerous and it led to cancers and it led to an increased risk of heart diseases and whatnot. And now, when they reanalyzed the findings of the study, they have found out that it was a highly flawed study, and women have gone without the benefits of HRT for so many years. Symptoms like, every woman who is in her perimenopausal state goes to the clinic with symptoms like, I'm not feeling like myself, which is just dismissed as, okay, this is just perimenopause or menopause. But there are medicines, or there could be a lot of innovation in this field which can really help women. And I feel that, because today we really study, or we really concentrate a lot on fertility, on actually delivering babies and bringing more babies in this world, which is, of course, my bread and butter shows. Why shouldn't we, so I'm really grateful for that as well. But then I really feel strongly that because every woman is going to go through menopause at some stage in her life, we need to put in more work towards this area.
Sure. Jhilmil, coming to you. It's wonderful to be a founder, be invited on a panel like this. People see the glamour of it when they look at it, but there are a lot of dark sides to that as well. Were there any moments in your founder journey where you felt like giving up?
The thing is that women are like underfunded. So when I started, I was very excited because you are pitching an idea that nobody has heard of. So later on, I got to know the more the idea is risky, the less funding you get. So, it was a little hard to digest because everywhere I pitch, people say, oh, wonderful, then I should be sitting with millions in my pocket. But that's not the case. And, I think that's why it has taken 9 years to build the startup also, because we have been living in, bits and pieces. And other than that, also what I've seen is that when a man pitches the, questions that he faces, in the same room, if my husband is talking, he is, okay, he's received in a different way. But when I am answering questions, it's question per question rather than, accepting my answer. So with that, mindset, you just have to move forward.
Dr. Smita, do you think, these data gaps lie? Are people not asking the right questions? Are people not... She also mentioned, of not being funded well, and women are underfunded as a blanket statement. And, where do you think the gap exists in a country? Do you have any data points, any questions that people don't ask?
The data is so scary, and it's very surprising. Imagine we are like 50% of population, right? Like, it's easy to get funding for dog startup than actually for anyone who's solving problem for women. And I really want to speak about the data. So there is one wonderful publication in Nature India, March 2025. Dr. Renuka was BIRAC chairman, and Dr. Kavita D&DI. Okay, and such a beautiful data that they have shared. Till 1993, women were not participating in clinical trials. They were not allowed to. And this happened after the thalidomide tragedy. In 1977, they said that it's okay, but still till 1993, FDA have to say that please include women in clinical trials. Now, the paracetamol, which we say that it is safe for during pregnancy, it's never been under clinical trials because it is before 1993, right? Majority of the drugs that we take, like we are speaking data, you're a pharmacologist. Okay, majority of the drugs that we take we do not actually monitor adverse event in women, not even after the post-marketing surveillance. And adverse events in women, because of the dosing disparity, it's twice than in men, okay? Classically, women are being considered as small men. But we are a different hormone system, right? We live in the cocktail of a hormone, and we're different species. That's how I explain it to my daughter. And if we look at other numbers, right? And I'll tell you the most surprising, majority of the studies, principal investigators are men. So only 10% are women. So if men are designing the study, how they are supposed to consider women in this. And now I'll tell you the biggest funniest fact, which again my daughter was laughing at it, is even in animal studies, okay, representation of women is less because female mice are expensive than male mice, and female mice are more for for creating more male mice for the studies, so they are more expensive, and that's the reason the funding, so that's the reason male mice are being studied. Also the variation that happen in the data because of the hormonal influence and other things, and that's the reason even in animal study. Now what are we speaking about? And am I supposed to fight for mice, women mice data, or for the female human species over here? So data gap is so huge, and we might not be able to solve that problem. I don't know how to solve that problem. If you are developing something for women health, how we are supposed to actually validate that? Okay, if their women are not participating, and there is also a campaign which says that give us the right to participate into clinical trial. Like imagine, like, do I have to fight for that? So that's the data we are speaking about. We don't have data, which is important. Of course, when we speak about other data, like how many of the fundings and other things, that's another topic to discuss. But even to validate your study, we don't have a data available. Okay.
Great.
So to add to that,
Yeah.
Because I just came across this thing that even the period products that we use, none of them are actually tested using menstrual blood. So even, the period panties or the pads or the menstrual cups, when they were designed, they weren't tested using menstrual blood. So you never know how much blood it is going to hold. So, if you have leaks or things like that, then, it's grossly, they use some fluids or they use some other liquids, but not blood, not the thing that it is supposed to hold.
Right.
So there's the gap in the data that, she was talking about.
When we talk of innovations and particularly clinical validation, what are some key data points which you think, you really want to look at saying?
I think the first, the most important thing has to be the clinical utility of it, the ease of use of the product. To give you examples, now all of us have period tracking apps on our phones, which has made life so much easier now. It calculates your ovulation dates, it calculates your expected period date and everything. Which is something that is, very practically useful, as well as it is the ease of use. You just have to enter the data in it. You have to just enter it. It doesn't take much of your time.
Great. Coming to data points for, somebody who's building in the space, right? And you are always operating in the gray, right? Sometimes you have a lot of data. It could be even insights, say, coming from a clinician, coming from patients, or insights coming from your investors. And you don't always have adequate data. And you are, trying sometimes to build a guesstimate around it, say we want to go with it. So how do you balance it as a founder? Data, gut, instinct, time, speed. How do you balance all that with data?
In India, nobody had done such a trial. So outside India also, the stage, the technology was very in the starting phase. So there is like very less literature also everywhere. And the trials also, we made sure that we have a good balance of data, age-wise. And I think people started believing it once we had enough data to show that, it has been working on these many people. And so far, we have more than 95% accuracy, and fingers crossed. So I hope, it doesn't reduce too much once our sample size increases.
Where do you think are these bottlenecks lying? Is it a regulatory challenge? Is it stigma about building in maternal health or building for women's health, or talking about any of those issues, whether you want to niche them out?
And I really, really want everyone to think about it. It's a seriousness issue. We are not taking it seriously. None of us, whether we are talking about venture people, or we are talking about startup ecosystem, or women ourselves, like everyone. We are not taking it seriously. And how I'll tell you. And I was looking at a data again, is less than 500 startups are focusing on women health in India. Now, very, very, very few startups are getting funds, especially if they are women-led startups. there is not a single women-centric venture capital companies available in India. There are few in US. There are few in Europe. They may say that, oh, women may not spend money on their health. Women are spending money a lot. I know how much it will cost to go to a salon and for my clothing and it's very expensive to maintain yourself and to have a little bit of a quality of life. So I am spending money, but then I'm not spending it on the right reasons because nobody's telling me what the right reason is. So there is a seriousness that is lacking from women ourselves, including everyone, and us, those who are startup owners. Now, if you take the responsibility that I'll do some startup entrepreneurship, anything in women health, are you taking it seriously? Okay, as serious as, let's compare it with men. They sacrifice so much, they leave everything. How many of us are actually saying that, okay, it's like a side hustle for me, or I'll give a try? How many of us are actually taking it seriously, ready to do that sacrifice, hours, time, irrespective of your, the menstrual phase that you are in and everything, but you are still ready to take a decision. So that's one seriousness that's not there. Other thing, like, we see people, probably all of you are looking at starting something in women health. How many of you are looking for getting into femtech? How many will say that, yes, I am working on women health, but my startup pitch would not include menstrual health, mom, baby, or reproductive health? Anyone who's doing anything which is excluding the reproductive health? Yes, what is it?
Pre-surgical epilepsy.
Oh, perfect. God bless you. So one in the crowd?
And in general, mental health and diagnostics.
Mental health. Okay, so just imagine. So this is actually, there is a term called Bikini vision. Okay, and it's a term, it's there on LinkedIn, people are writing about it. Because whenever it is women health, it's about only the reproductive health. In my whole life for 48 years, only 2 years I was focused on my reproductive health when I was pregnant and when I was taking care of my baby for 6 months, right? That's it. After that, I'm a human being here. I have different organs. More women are dying because of cardiac diseases and not because of cancer. But everybody thinks that cancer is a leading cause of death in women. And so much of solutions that are happening. How many women are actually disabled because of osteoporosis? Now we say that, Amma ji hai, pair mein dukhta hai, ghar pe baithi hai. That's a disability. And it is preventable disability. Osteoporosis, you need DEXA, you need serum calcium, and you need vitamin D3. The medications are super sasta. You don't need to actually do too much to actually prevent osteoporosis. But do we do it? Diabetes. Okay, how many women are actually bedridden because of stroke? It's a big number. But whenever anybody want to start something, ovulation tracker, wahi chal raha hai. Baby, I'm so sorry. Like I love my daughter. Okay? but it's all about like reproductive health. Udhar hi ja raha hai fund.
And I'm going to ask Dr. Manasi a bit of a clinico-marketing kind of a question. But how do you see that in the real world? Is it still there? Is it still, because I remember a generation ago, it would always be like, you were in the wards and they would still be like, I will have to ask my husband. Or I will have to ask my son. Women are always stuck between those two things when it comes to health choices. And how has that changed, maybe?
Yes, that has changed, though not to the extent that we would like it to be changed. But yes, we do see a shift in which women are taking charge of their own health. They are independent, so they come to the clinic by themselves, they seek help. But unfortunately, what happens is that many times their problems are dismissed. So, like she very, very rightly said, we don't take them as seriously as they deserve to be taken. So, because many times what happens is, I'll again come back to menopause, because osteoporosis and all of this is again linked to menopause.
Right.
Because estrogen is the hormone that is protective. Once you lose it, you have the incidence of hip fracture in women above 60 is 15%, and of them 10 to 15% lose their life within the first year of a hip fracture.
Yeah.
So they are bedridden, they lose their lives. I have lost my own grandmother to a hip fracture, secondary to osteoporosis. So honestly, I feel that we need to take women more seriously regarding the problems that they are coming up with. Yes, it is true that, we need to look at it as a holistic health sort of thing. Another thing that I would also like to talk about is that, strength training, because this is something that is very, very misunderstood because women often feel that, lifting weights will make them bulky. If there's a woman who goes to a gym, she is often put on the treadmill and she's not the weight section is, frequented just by men. But that is not the case. There are enough studies, there's enough evidence now to show the beneficial effect of building muscle on women's health in all the fields, even osteoporosis for that matter. So, because your muscle is going to protect your bones, even for PCOS and things like that, even again coming back to reproductive health, that's what I do. But then, for everything, the solution is in strength training, which we are, often dismissing. Yeah, but then coming back to your original question, the focus is changing, though I would like it to change more. I'm not, we are happy with the direction in which things are going, but then not to the extent as it should.
Great. Great. Let's look more futuristic. You spoke of some examples of Europe or US where they have women-led venture funds or women-led businesses. Do you think changing that or bringing like a women-only company? We see a few startups, I forget the name, which says they are fully, staffed by women. Everything is women-owned. Do you think something like that creates a distinction, or that's anyway being done? So how would you like to look at it?
If I have a free will, probably I'll divide the world in half. Let women be happy in this side of the world. Let men be happy in that side of the world. We'll collaborate during events and things when it is required. And it will be much peaceful, at least no war, no discrimination. We will be very inclusive of men in our world. We will take care of their health and everything. And I see scale is another big problem. Scale is something that, again, we have to address and think about it at this stage especially. Historically, women have to prove more to get funds and to get ahead compared to men-led companies, exclusively women-led companies, CEOs that are there. Because men are doing Peaky Blinder deals, and they are, right? But women, they have to prove 3 times more than any other idea. Women overdo. Whether the world is asking or we are like that, I don't know. I don't have that answer for that. Because I am building my startup for last 3 years and people are like, why you didn't raise funds? And I have no answer for that, right? Maybe we overdo, and probably that's how our nature is. But one thing I'm very sure that, and I have seen that when women get investment, they really value the return of investment is much higher. Because they know yaar mehnat se liya hai maine. I know what it takes to raise that one funds and single fund and other things, and they take it very, very seriously. Especially exclusively women-driven companies I have seen. My goodness, how great returns they do. So I think more important along with such ecosystem is think not just about the innovation, but also think about scale. Just not think about what I'm solving the problem locally, but also how my problem can be relevant to global thing. Because see, we have to, it's not like proving, like not in a negative way that I have to like prove the world. Waisa nahi hai. I'm not a very classic feminist. In fact, majority in my life I am being supported by great men, those who supported me in business, than women. Girls don't help each other. I don't know why. Men are like help kar lete hai. Hey bhai ye chahiye, haan ho jata hai aise. So men are very supportive. So I'm not that typically ye, but I feel scale. That it's a responsibility that if you start, you can't quit, because then what my daughter is going to see, right? Like she needs something to look forward. Second is, I'm excluding men from this whole discussion. There are guys, those who are doing femtech and other things. I'm so sorry. Today is my day. Companies, those who are investing and giving opportunity to women. Then thinking about how my business is going to get launched in GCC market or Thailand market. That's what NXT we do. The day I thought that I should do it, I was like, this is not enough. India to ho jayega. What if we are able to create some portals for GCC as a market, Thailand as a market, South Korea as a market, Poland as a market? These are the ones that I'm able to so far acquire. Let's see what are the other things that I can create. Dream bigger. Bigger, you should be scared of your own dream. And then you're like, I'm not going to quit. It's like that, right? And that's what that's like, I don't know. I'm Alice in a Wonderland. But that's the world I want to live.
People have got it, they've understood where you're coming from, and they're obviously going to get the emotion right. And maybe coming that to you, you see day-to-day challenges in practice, you see day-to-day innovations failing, right? Clinical validation doesn't happen. How do you see that ecosystem evolving, where doctors are partnering more with innovation. We are very averse, right? I mean, till I did not enter or venture into corporate and startup ecosystems and all, I figured my only friends were doctors, right? Like, because you spend 10 years there, so you don't end up having any other social circle. So, we are very attuned to only that and not evolving in our understanding of how, technology has moved so quickly, how startup ecosystems moved, how clinical validation has moved, how doctors will probably be at the forefront when it comes to healthcare innovations. How do you see that evolving?
More sessions like these are definitely going to help because, and of course, getting out of your comfort zone and meeting new people, getting to know more about other things that are not related to what you do is something, because as doctors, I think the first challenge we faced was getting from the pen and paper to the digital medical records. That was also a huge challenge, and a few of us are still facing that, because the old timers, they are still used to writing their prescription down by hand, and it's really difficult to get doctors to write in legible printed hand prescriptions. Yeah, but then I think we really need to get more doctors to startups or startups to doctors in order to get a two-way communication,
Right.
to get more of an open discussion. Because there needs to be an interchange of ideas to actually sit down and think whether this is working, or what are the challenges that might be faced by also by doctors, in order to get used to or accustomed to the new technology or the new ventures that come up, and also by the startups to know that how, because as an idea something might look really great, but in practice it might not really work as well. So the practical implications really need to be discussed and maybe tried out before we can actually call it a day.
You worked in AI, right? If you need to start any women health femtech company now, so then what it will be? What do you think?
So I think, one is, of course, not just menopause as one part, but I look at, women 50 plus. Say, let's be classify, because it's women, we call it menopause. Had it been men, we would still call it 50 plus. But I think that is one bracket where I would want real work to happen, because there is a lot happening for senior living. There's a lot happening for chronic diseases. There's a lot happening these days for cancer and for many other places. But what you're not focusing on is those day-to-day challenges which are going to come up when you're 50 plus, maybe be it osteoporosis, be it mental health, be it empty nest syndrome. I mean, there are tons of challenges which come in when you are 50 plus. And I think that's one area where I see not many people are going to work into, because they don't see it as, the reproductive market or the menopausal market. So they're like, oh, where are we? Or somewhere in the middle. So yeah, maybe we'll not end up getting the right kind of funding, but that would be something I would want to venture into. Yeah.
So thank you so much.
Thank you.
to Jhilmil, to Smita, and to Dr. Manasi as well. But yeah, thank you so much, Robert.
Thank
Let's
you.
clap for ourselves.